Hello, good evening friends. Today we'll be discussing about anatomy of salivary gland, that is parotid gland. Before starting, I would like to thank Chandana Shri Ma'am for sharing the wonderful notes with us. These notes are very helpful for quick revision and the link for the notes is given in the description below. So you can download it from there, and without further delay, let's get started for the anatomy of parotid gland. So parotid gland is the largest paired salivary gland and it is situated in the parotid space. So this is the parotid space we can see. So anteriorly we have mandibular ramus. This is the mandibular ramus. Medially we have styloid process. Here is the styloid process. Then posteriorly we have mastoid process. So mandibular ramus anteriorly, posteriorly mastoid process. Medially we have styloid process, and posterior superiorly here we have external auditory canal and TMJ, temporomandibular joint. So as we can see, this is the parotid space and the surrounding muscles are masseter. Then we have stylohyoid muscle and posterior belly of digastric and sternocleidomastoid here. In the transverse section, we can see that the parotid has having two lobes, that is deep lobe and a superficial lobe, which is also known as exophageal lobe, which is more 80%. And posteriorly, as we have seen, that we have mastoid. There is attachment of digastric posterior belly and sternocleidomastoid. Digastric is on the medial side and sternocleidomastoid in the lateral side. There is on anteriorly there is mandible, and medially to the mandible is the medial pterygoid and laterally is the masseter. You can see that in the substance of the parotid there is a nerve passing. The yellow one is which is the facial nerve, starting from the stylomastoid foramen. Starting near the styloid process here, and it is not from the stylomastoid foramen. Then just besides it medially is the styloid process. In the substance we have a fasciovenous plane of Pette, which is having the artery and vein, which is the external carotid artery and the retromandibular vein. And beneath the deep lobe is the carotid sheath, which is harboring the internal jugular vein, internal carotid artery, vagus and sympathetic chain. And medial most is the muscle, that is superior constrictor muscle. In the cross section we can see the various surfaces, the lateral surface sorry, the anterior surface and the posterior surface. Apex is below. In this diagram we can see the facial nerve dividing into 5 branches, that is the cervical, marginal mandibular, buccal, zygomatic and temporal. This is the parotid duct and it is moving along with the transverse facial artery. And below is the vein, that is retromandibular vein, besides the artery, external carotid artery, and superiorly the last part is continuing as the superficial temporal artery. There is a tributary joining the retromandibular vein, that is posterior auricular vein, which will form the external jugular vein. So this facial nerve dividing into 5 parts is known as pes sensorinus. Now we see the venous channels, which is meeting in the parotid or passing through the parotid. We starting from the superficial temporal vein, which is joined by the middle temporal vein and maxillary vein, which continues as the retromandibular vein, which will divide into posterior division and anterior division. The anterior division will join with the facial vein and form common facial vein, and the posterior division will join with the posterior auricular vein to form external jugular vein. So this is the main vein of the retromandibular vein. Now we see the facial relation. The parotid is encased by a split of investing layer of the deep cervical fascia. So the deep cervical fascia that of the neck splits into two and encases the parotid gland. So the superficial layer which invests the masseter muscle, and further it attaches to the zygomatic. So outside it invests the masseter muscle of the jaw and is attaching to the zygomatic arch. In the inner part, that is the deep layer, it passes superiorly and attaches to the base of skull near the external auditory canal. And the part of this deep layer is thickened to form a stylomandibular ligament, which is seen here in the diagram. And this ligament supports the parotid gland from the submandibular gland. It supports TMG. The stylomandibular ligament supports TMG, temporomandibular joint, and it also separates the parotid gland from the submandibular gland. So skin over the parotid gland is supplied by the greater auricular nerve and auricular temporal nerve. These are the two nerve supply. Now we see about the parotid duct or the Stenson's duct, which is enveloped in the deep lobe of the parotid with only small ductule connected to the superficial lobe with the duct. So it is mainly in the deep lobe of the parotid, and the deep mein hai. Then it is connected to the superficial lobe with help of small ductules. This parotid duct or Stenson duct is around 5 cm long, lies in the superficial surface of the masseter, 1 cm below the zygomatic arch. So just below the zygomatic arch, 1 cm below, it lies the parotid duct or the Stenson's duct. Then transverse facial artery is interposed between the duct and the arch. When the duct reaches the anterior margin of the masseter, it sharply turns inside and pierces the buccinator. So it goes ahead from the deep lobe and it reaches the anterior margin of the masseter and then sharply turns inside medially and pierces the buccinator, and it terminates in the vestibule of the oral cavity, opposite to the upper second molar. So upper second molar, near that, the vestibule of the oral cavity, it terminates and opens the contents of the parotid gland. Now we see the neurovascular structure. From superficial to deep, we have NVA, that is nerve, vein and artery. So artery will be the deepest and nerve will be the superficial. Arterial plane. So external carotid artery enters the parotid space after passing deep to the digastric posterior belly and gives off a posterior auricular artery. From that, there arises stylohyoid branch which enters the stylohyoid foramen, and this stylohyoid branch lies superior to the facial nerve. So we have to be careful while dissection. When we reach the stylohyoid branch vessel, then we will have a facial nerve beneath it. And external carotid artery at the mandibular condyle terminal branches, which are superficial temporal and maxillary artery. So it pierces the medial surface of the gland, the artery. Venous plane is superficial to the arterial plane, as you have seen, and it includes retromandibular vein and its branches, as you have seen the branches of the retromandibular vein. So veins will be having branches. I made a mistake that I just told it was our tributary, it is branches. So we'll correct it. Now nerve plane, that is the facial nerve, after exiting from the stylomastoid foramen. So as I had mentioned, it is stylomastoid foramen from where the facial nerve is exiting. So extra parotid position. So posterior auricular nerve, posterior auricular muscles and intrinsic muscle of auricle. So this will be given by the facial nerve, posterior auricular nerve, which will supply the posterior auricular muscles and the intrinsic muscle of the auricle. Then it will give nerve to the posterior belly of digastric and stylohyoid. So this will give two branches, one is posterior auricular nerve and nerve to the posterior belly of digastric and stylohyoid. Then it will pierce the parotid at the posteromedial surface and will give two branches, that is one is temporofacial and other is cervicofacial. The temporofacial, which is upper part, which will give the superior most temporal nerve, then secondly the zygomatic nerve, thirdly the cervicofacial, then there is cervicofacial which will be divided into three, that is buccal, then we have marginal mandibular and cervical. Now we see the autonomic nervous innervation, that is through the inferior salivatory nucleus. So these will supply the secretomotor parasympathetic fibers, parasympathetic supply autonomic, through the glossopharyngeal nerve, which will give the lesser petrosal nerve, which will merge with the otic ganglion, and from the otic ganglion there will be auriculotemporal nerve, which will be supplying the parotid. Then the autonomic sympathetic will be given by superior cervical ganglion, which will give the posterior ganglionic sympathetic fibers, and these form the plexus of nerves traveling along the external carotid artery, and it will also supply parotid gland. So plexus of nerve traveling along the external carotid artery. These postganglionic sympathetic fibers will also supply the skin and sweat glands of the parotid region of the superficial part. So when damaged, it will lead to Frey syndrome, right? So lymphatic drainage, sorry. So it will be by the preauricular nodes, the superficial node in the superficial fascia drain into the superficial system of cervical node along the EJV, external jugular vein, and then later in the supraclavicular nodes. And nodes within the parotid fascia will drain into the deep cervical nodes and later in the jugular chain. These nodes are outside the gland but beneath the fascia. So these are also known as subparotid nodes. Then there are several lymphoid follicles and 4 to 10 lymph nodes in the substance of the parotid gland, and these are along the posterior vein and external jugular vein. So along the veins, these lymph nodes are there which are in the substance. So this was all about parotid gland anatomy. Hope you have understood. So keep studying, keep growing, and see you in next video. Thank you for watching and never give up. Thank you.